Welcome to this educational video about aortic coarctation, a congenital heart defect where the aorta, the body's main artery, narrows. We'll explore its causes, effects, diagnosis, and treatment options, providing you with a comprehensive understanding of this condition. The exact cause of aortic coarctation is often unknown, but it's generally considered a congenital heart defect, meaning it's present at birth. It's thought to arise from issues during the formation of the aorta in the developing fetus. Genetic factors may play a role, and it's sometimes associated with other conditions, such as Turner syndrome. Aortic coarctation obstructs blood flow through the aorta. This narrowing forces the heart to work harder to pump blood throughout the body, especially to the lower extremities. Blood pressure increases significantly above the coarctation and is lower below the coarctation. Over time, the increased workload can lead to left ventricular hypertrophy, or enlargement of the left ventricle. If left untreated, this can lead to heart failure, stroke, or aortic rupture. Aortic coarctation affects approximately 4 out of every 10,000 live births. It accounts for about 5–8% of all congenital heart defects. While it can occur in both males and females, it's more common in males than females. The overall prevalence might be underestimated as some mild cases may go undiagnosed until adulthood. The signs and symptoms of aortic coarctation vary depending on the severity of the narrowing. In severe cases, newborns may experience difficulty breathing, poor feeding, and pale skin. Older children and adults may have high blood pressure in the arms and head, and low blood pressure in the legs and feet. Other symptoms include headaches, nosebleeds, cold feet, leg cramps, and fatigue. Some individuals with mild coarctation may not experience any symptoms at all. Diagnosing aortic coarctation typically involves a physical exam where a doctor may notice a heart murmur or discrepancies in blood pressure between the upper and lower extremities. Diagnostic tests include echocardiography, which uses sound waves to create images of the heart and aorta. Other imaging techniques like magnetic resonance angiography (MRI) and computed tomography angiography (CTA) can provide detailed views of the aorta. Cardiac catheterization may also be used to measure pressures in the heart and aorta and to perform interventions. While a single unifying classification isn't universally used, aortic coarctation can be broadly categorized by the location of the narrowing relative to the ductus arteriosus, a blood vessel present in fetal circulation. Preductal coarctation occurs before the ductus arteriosus, juxtaductal coarctation occurs near the ductus arteriosus, and postductal coarctation occurs after the ductus arteriosus. Another way to think of it is as native coarctation, present at birth, versus recoarctation, occurring after previous repair. Treatment for aortic coarctation aims to relieve the obstruction and restore normal blood flow. In newborns, medication like prostaglandin E1 may be used to keep the ductus arteriosus open, providing an alternative pathway for blood flow until definitive repair. The main treatment options are surgical repair and balloon angioplasty with stenting. Surgical repair involves removing the narrowed segment of the aorta and reconnecting the ends, or using a patch to widen the aorta. Balloon angioplasty involves inserting a catheter with a balloon into the narrowed area and inflating the balloon to stretch the aorta. A stent may then be placed to keep the aorta open. The choice of treatment depends on factors such as the patient's age, the severity of the coarctation, and the presence of other heart defects. Regular follow-up is crucial to monitor for recoarctation or other complications. As a congenital condition, aortic coarctation is generally not preventable. However, proper prenatal care and genetic counseling can help identify potential risk factors and allow for early diagnosis and intervention if the condition is present. The prognosis for individuals with aortic coarctation is generally good, especially with early diagnosis and treatment. However, long-term complications can occur, including hypertension, recordic aneurysm, and coronary artery disease. Regular follow-up with a cardiologist is essential to monitor for these potential issues. Recent research has focused on improving minimally invasive techniques for repair, as well as understanding the long-term effects of coarctation repair on cardiovascular health. Advances in imaging techniques are also improving our ability to diagnose and monitor this condition.